Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Jeremy Drinkwitz. He's the president of the Mercy Hospital in Joplin. Joplin currently has the worst rate of COVID hospitalizations in the country, and 3 of the surrounding counties it serves are also in the top 10. So he spoke about how the current surge is impacting his community and hospital staff. Here's Jeremy.
So 95% of the patients that we have admitted for COVID, as of right now we're speaking, are unvaccinated. So, and that has been consistent every single day between 95 to 97%. So, the first wave or second wave, or I don't even know what wave we're on right now, it was the older population. And we, as a community and as a country, rallied to protect our seniors and did a great job and got vaccinated. But yeah, we have most of the people on our ventilators today. We have 50-year-olds, we have 40-year-olds, we have a couple 30-year-olds, a couple 60-year-olds, but we don't have anybody over the age of 70 on a ventilator. And, they should have good years ahead of them. And so we're doing everything we can to save them. But the challenge is these patients believe false information about the vaccine. And so the hard part mentally for our staff is we know that these admissions and we know that the people that we're taking care of that are dying are preventable, and you look at patients and you think, man, we shouldn't have to be taking care of these patients if they just got a vaccination. And that's becoming a big challenge. I tell you what I step back and think about, though, is the mental toughness of our team, how resilient they are. I mean, you're talking about a facility that was destroyed by a tornado that they rallied into a hospital tent and then a modular building and then this building. And so they're digging deep. It's a little tougher this time around for sure, because that hope of being through this and the hope of getting back to normal has dissipated. So there's frustration, there's irritation. But they're not going to give up. They're not going to quit. They can be mad and they can be irritated, but they're going to give the best that they got to save people. I mean, when you walk in that ICU, it's challenging. It is a difficult environment in the way that they treat those patients with kindness and compassion and tenderness. And I think that if people would just step back and honestly have a conversation and look at the data, we don't have an agenda. We're trying to save people's lives. We're reporting the facts. And so the facts are 95% of the patients in our hospital right now are unvaccinated. And the facts are that the vaccines has significantly helped those going forward. We've almost given 4 billion doses of the vaccine worldwide. So this isn't an experiment anymore. It's working. This is probably the greatest vaccine since the polio vaccine. And this is saving people's lives if people would just step back and see it. If you really love people, right? If you love your community, if you love your friends, if you love your neighbors, it causes you to do action. So one of those actions is get a vaccine. The other one is to wear masks, social distance, do the things that you know to do, and be diligent about it. Not because somebody's asking you to do it. It's because it's the right thing to do because you love somebody. Love requires action.
That was Jeremy Drinkwitz with Mercy Hospital in Joplin, speaking about the impact of the current COVID-19 surge and hospitalizations on his community. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.